Otorhinolaryngology is surgery that deals with procedures of the ear, the otto, the nose, the rhino, and the throat, the laryngo. This specialty is also known as ENT, or ear, nose, and throat. Review the outcomes for this chapter. The picture on the left shows you the total anatomy of the ear, composed of the external ear, middle ear, and inner. The external ear includes the auricle or pinna, the auditory meatus, and the external auditory canal that terminates at the tympanic membrane. Pre-auricular means in front of the ear, and post-auricular means behind the ear. The middle ear includes a tympanic membrane, also called the eardrum, the ossicles, the malleolus, incus, and stapes, the opening of the eustachian tube, the opening of the mastoid cavity, and the intratympanic portion of the facial nerve. The tympanic membrane is elliptical and conical in shape and aids in the process of hearing by transmitting sound waves to the ossicles. The auditory tube, or the eustachian tube, extends into the nasopharynx and assists in equalizing pressure. However, it is a pathway for bacteria from the nasopharynx, causing otitis media or middle ear infection. The inner ear contains receptors for hearing and balance and is composed of a series of hollow tunnels called the labyrinths. The cochlea is a spiral-shaped structure which contains a cochlear duct and the organ of hearing, also called the organ of Corti. The semicircular canals communicate with the middle ear via the oval and round windows. In each of these canals, there's an enlarged space called the ampulla, which is responsible for equilibrium of the body in motion. There are several pathologies of the ear that may bring the patient to the doctor, and some of these require surgery. The external ear can get an infection, also known as thrombosed ear. Tumors on the external ear are the most common site for skin cancer. The pinna of the ear can also protrude, leading to an odoroplasty, but we'll discuss this in the pediatric chapter. The middle ear can hold trauma such as a ruptured eardrum, cholesteoma, which is a complication of chronic ear infections where the tumor or cyst can erode the mastoid bone, and osteosclerosis, which is a fixation or scarring of the bones of the middle ear. This is most common cause of conductive hearing loss. The inner ear can have recurrent vertigo with unknown cause. Patients are usually positioned in the supine position with their head turned away from the affected side with the head on the donut headrest. Some PrEP solutions such as Hibiclens and those for alcohol are oxytoxic and cannot be used on or near the ear. A sterile cotton ball is often placed in the ear during. The post-auricular area is often prepped for skin grafts on the operative side. Lidocaine with epi is most often used as a local anesthetic because it also controls bleeding with gel foam is a common hemostatic agent, and corticosteroid octic is the antibiotic mixed with the anti-inflammatory. Make sure that the medication says octic or safe to use in the ear. Many drugs and substances can be ototoxic and cause hearing loss or deafness. Make sure you are familiar with the ENT instruments. The most basic ear instruments are ear speculums, Fraser suction, ear hooks, curettes, and alligator forceps. An ear dressing may be as simple as a cotton ball placed in the ear, a special apparatus called the glasscock dressing, or complex like a mastoid dressing. If the effusion or fluid in the middle ear goes untreated, it can lead to infection, mastoiditis, hearing loss, or perforation. A surgical opening can be made into the tympanic membrane to release fluid from the middle ear. This is called migrainotomy. It's one of the most basic ENT procedures. A meningeoplasty is performed to close a perforate tympanic membrane, however, the middle ear is not entered. This perforation can be a result of persistent opening after the removal of a tympanoplasty tube, which are ear tubes, a blast injury, or a penetrating foreign object in the ear. A paper patch or a fat graft can be used to repair the eardrum. If a fat graft is used, it's usually taken from the tissue near the ear, from the temporalis fascia. A tympanoplasty is the repair of the tympanic membrane and the reconstruction of the ocular chain to prevent conductive hearing loss. Ocular discontinuity can result from chronic otitis media, trauma, or cholesteatoma. A mastoidectomy is the removal of diseased bone. The mastoid air cells in the soft tissue lining the air cells of the mastoid. A mastoidectomy is the removal of diseased bone, the mastoid air cells, and soft tissue lining the air cells of the mastoid. A stapiotomy and a staphyectomy are the removal of the stapes superstructure and creating an opening in the footplate or removing the entire stapes for the treatment of profound hearing loss, usually related to otosclerosis. A prosthetic is placed into the stapes to allow the transmission of sound waves. A cochlear implant is used to transmit external sound directly to the eighth cranial nerve. These implants are contraindicated. That means not recommended in an electronic processor which is implanted outside the ear over the temporal bone and captures sounds and sends it in a digital form to an internal transmitter. This transmitter conveys signal to electrodes which are implanted in the cochlea.